Hi, my name is Madeline and I'm a registered and licensed occupational therapist. Today we're going to be going over 5 OT specialties to learn a little bit more about. So whether you're a pre-OT student, you're currently in a program, or maybe you're even studying for the MBCOT, this will give you a little bit more background on a specialty that maybe you'll want to pursue in the future. So the first one we're going to go over is becoming a mental health occupational therapist. These OTs work with individuals whose lifespan issues or relevant conditions are impacting their occupational performance related to mental health. These patients could present with difficulty problem solving, maybe emotional regulation, stress, plethora of things where as a mental health OT, you would come with interventions that worked on strategies or adaptations to really set them up for success to combat these challenges and to make them as productive as possible in their activities of daily living. The second specialty we'll cover is becoming a physical rehabilitation therapist. This certification is quite broad, but really it focuses on maximizing function and independence. It could also support vision, cognition, and hand-arm function as well. So some patients you might see here are individuals after a stroke needing to learn one-handed daily tasks, or maybe transfer training for someone after a hip replacement. These therapists can work in a variety of settings ranging from school systems to home health or rehabilitation or hospital settings. The third specialty is becoming a hand therapist. So OTs who specialize in hand therapy assess and treat problems related to the hand all the way through the entire upper extremity. They often start working with patients right after an injury or surgery to help get them back to their work or productive lifestyle as soon as possible. Some interventions they could incorporate would be therapeutic exercises, including splinting for their patients, work conditioning, or assistive device training, among many others. The fourth specialty is driving and community mobility. So as OTs, we know that mobility is an essential part of our holistic view of patients. And so with this specialty, it really focuses on the client's ability to be mobile in their community, whether that's driving, using public transportation, or walking. Some things you might see here are teaching a patient new strategies to return to driving, legally advocating for your patient's right to drive, teaching teens with disabilities to drive, or maybe teaching a patient how to use a new form of public transportation. The fifth specialty is environmental modification. These occupational therapists work with clients to modify or adapt their current environment, whether that's their home, school, work, or community, to maximize their occupational performance. So this would be determining the current environmental needs and either working with assistive devices, technology, or adaptations to promote safety, independence, and accessibility in their lives. Overall, environmental modification therapists who specialize in this area help make their clients safer and more independent in their current environment. These are just 5 of many occupational therapy specialties that you could explore. As OTs, we always provide a client-centered approach with the ultimate goal of helping our patients achieve the highest level of independence as soon as possible.